had it down in Titusville.
Okay.
But I was in the hospital still, and I got one, I don't even know what they did to me. They gave me the 6 shots in the back, the lower back.
Yeah.
And, really didn't make my back hurt worse, to be honest with you. But a long time ago, cause my hips, I got cortisone shots in my hips. And it only lasted for like maybe a week. Anyway, I'm allergic to like, like naproxen and the steroid packet. So they didn't give me the cortisone. They couldn't give me the cortisone in my back. They just gave me the, lidocaine, I guess? But I don't know.
So that's why they don't last very long. When somebody can't have steroid, they only last a few hours. So
that's
it's very
what I'm
important.
saying. So why did they even
Because they're called diagnostic shots. So if you document relief for even if those few hours, then it's worthwhile to go on and do the radiofrequency ablation, which is just done with heat. There's no steroid in that procedure. But if you can't tell, you don't remember, then what they usually would do is somebody like you is repeat it.
Yeah.
With just lidocaine.
They didn't do nothing. I even had to, I went to the emergency room back home, because I thought maybe something happened, when they gave you the shots. I thought maybe they, I don't know, hit a bone or whatever.
They're supposed to go into the joint, yeah. Sit right on top of the bone, yeah. Right there. Yeah.
Okay, well, my back was hurting, so I thought that, something went wrong, or I didn't know.
That's not what emergency rooms are for. They're for strokes and heart attacks, not for back pain.
I know.
There's a big campaign out there these days. They're putting it on national television and everything.
Know.
Stop going to the ER for things that are not emergencies.
Okay, may I say something? Okay, my primary doctor, every time I call, I have a lot of medical issues.
Yeah?
Every time I call, no, we can't see you today. We don't do that until Friday.
What are you calling about, though? Emergencies or just I have pain, something's bothering me?
No, something, yes. Yeah, maybe my sugars are 600. Can I come in? I went Thursday, okay? I have these tumors on my feet. They're too big to take out.
Try the urgent care centers, but try. And doctors are telling people.
I was telling my primary doctor that my foot was hurting because right down the hall is a podiatrist who I seen a few months ago. All I needed was a referral. He tells me, that's Lisa, your problems. I said, everything is a problem. You just got to address it accordingly. Anyway, I had to go to the ER, and it was getting infected. I had one of my tumors. My Aunt Linda was diabetic, and she lost half a foot. Yeah, so that's important.
Yeah, that's
but
important.
Everything's
a little bit of back pain.
But everybody's pain tolerance is different. And,
yeah, we know.
And I see her.
She's on. That's why she's on morphine.
I'm not saying
you're medicated.
Little pain.
Now
the Embetta. Oh my gosh, the Embetta. I was taking 2 times a day. I have these 3 fingers. It's weird because they told me I had carpal tunnel. Okay, that's why my hands were numb. I wake up this morning.
Do you have splints? Did you get splints for it at home? They're at Walmart.
But this hand is not numb anymore, no more. And these 3 fingers are number than crap.
You want to do a test to find out if you have it or not? That's simple enough to do. It's called an EMG nerve conduction study.
Oh yes, may we do that?
Yeah, that's just
that would be awesome. Instead of they just look and
if you have that, you should be wearing splints. We can do a shot for it. That helps people for a few months at a time. If it's severe, then you have to see a surgeon for a release. It's not a vague symptom. It's not a vague problem.
Yeah, I know. I have okay. But when I was in the hospital, because they did a CT, right?
Yeah.
And they told me the reason was because I have a bulging disc thing in my neck that is on the nerve.
Could be.
One doctor says, no, don't get, because they told me I should have surgery.
If that's the case, we can do an epidural for it. Where's that CAT scan report? It's true. I'm telling you.
No,
that's what we do around here. All of these things,
okay,
you know?
Yes, well, the CAT scan is at the hospital.
Well, which hospital did you go to?
Rustov in Rockledge.
So you'd have to sign a release for us to get a copy of that.
Okay, yes. That's what I'm trying to do. Get somebody, just get down to it, man. Find out what's wrong.
Release.
You know?
CT of the cervical spine. When did you have that cervical spine CT done?
Well, it was Oh. From maybe the 28th of March, because I was in the hospital March 1st. So I'm not sure if they did it the day
So,
before
Within
or.
the last month or so.
Oh, yes. I was in there again, yeah. And, I just want to, come on, man, I'm tired of.
Okay.
Anyway, the Embetta, I was taking, I was like, having side effects. Yeah, I was seeing double. My friend over here, seeing shadows, I'm gonna say. I got like going crazy. I quit taking it, and I was feeling better. So it was, because we
So
looked
you'd
at
rather go without them.
well, no, if
That's-
I can get something else, I don't know how y'all operate, and I've never done this. Cause can you like try a different one, or do I have to take that one?
Well, we prefer long actings. I'm looking
Yes.
at your last drug screens. Nothing's on any of them. Were you taking pain medication before?
Yes, I was
Because your
taking
drug screens come up negative for everything.
Percocets, and then
Your first one was negative for everything. Your second one was negative for everything. I don't know. I don't have anything.
when we went to Dr. Malik over in Orlando, that's the first one I seen. Okay.
Dr. Malik is my partner. He's not in Orlando. He's in our practice.
We went to Lake Mary.
Lake Mary.
Yes.
Yeah, we have one office there. Yes.
But
And the first time that we screened you, it came up negative for
right, that's why I had to go to pain management, because my primary doctor could not, he only prescribed me one time. They're not allowed to do that. That's why I had to start going to pain management. So when I went to pain management,
Well, let's get some studies done. I don't see anything really here. I mean, so far the work on you's been very light. Let's get
Yes.
some studies done. I don't want to really throw narcotics at this until
well,
I know what.
I'm in pain though.
Well,
I'm
I'm
tired
sorry.
of.
We don't throw narcotics. That's why we gave you a nice long-acting medication.
Okay, then I
We don't like to give out pain pills when we have so many other talents
Right, no, I
and abilities here to
understand
do
that,
things.
yes.
That's the whole point
Okay,
of coming
then I
here.
would do the Embetta.
But you said you stopped it. It's not the kind of
Well,
medication
just
you
to
stop and
see-
start. It's a 12-hour time release. You stay
Uh-huh.
on it consistently, like blood pressure medication.
Okay, I didn't know that.
Yeah.
I'm new. to
Yeah,
all this,
it's just read the directions on the bottle every 12 hours. It doesn't
the,
say as
the
needed.
bottle, okay.
Twice daily, right?
Twice daily, yes,
Right.
ma'am. Yeah.
So like 9
Yeah.
a.m., 9 p.m., or 8 a.m. and
Okay.
8 p.m.
Okay, but if I have a question,
Ashley.
no, I have a question.
Don't be rude.
If
They sing, this is my daughter. I'm so sorry.
she's taking the Embetta because she drives my sister to work,
Ashley.
That's fine.
Yes.
and
It's a time release morphine.
but if it's giving her such side effects,
It was.
and
It was.
but let me finish, and something happens. God forbid she's seeing spots and
then
she
she
can't see
shouldn't
correctly.
drive. That's a judgment call on
Yes,
her. That's
Ashley,
not on
shut
her
up.
doctors. That's on her. That's a judgment call on the patient. If you can't do it, don't do
Gosh.
it. There's enough warnings. There's a whole thing that comes with this when
Yeah,
the
that's
pharmacist
why-
gives it to you.
Mhm.
It tells you if you have this, or this. If you
Yeah.
don't feel this way, don't drive, and that kind of
Oh
thing.
yes, I know.
You get
all this.
plenty
This
of information about that. If somebody doesn't have those side effects, they drive,
Mhm.
and they keep it with them so that in case anything happens, they can say, "I was on this medication,
But
by
that's
the way."
what you're
you know.
supposed to do. I always keep it in my purse, so their bottle, So even if I was to get pulled over for speeding, But
I don't.
I was
do a
gonna
good job. Speeding's a whole other.
No, I know, but I'm just saying.
But I mean, you've been
I
given it
have carotid arteries also. That's not, I need a vascular. I'm getting lack of oxygen to my brain,
So
according to my doctor.
do you see that? Have you seen?
I need to. I go.
Okay.
I got too much going on. It's like, oh, whoa.
You're on Ativan 1 milligram twice a day. That'll do more to affect your cognition than anything else.
I don't take that.
Okay.
I don't take Ativan because it makes me tired.
Yeah, I was
I
gonna
don't
say
like
that's
stuff.
the thing.
All my medicines, like my heart medicine, my lisinopril, and all that,
Yeah, that's
I take
fine.
at nighttime because some of it makes me tired. I don't like to be tired.
Are you on Flexeril or Tizanidine? Because both of them are listed in your current meds, and you shouldn't be. You should only
Okay.
be on one.
I know. I have Flexeril from a long time ago. I don't like taking muscle relaxers. They're muscle relaxers. Muscles are different than the bones.
No, we don't want people taking. That's why a lot of insurances will no longer cover them on a monthly refill. They're only
Yeah.
letting people do them every other month
Good.
because they're trying to tell people don't take these all the
You know,
time.
your heart's a muscle. It can slow your heart down. I don't take, very seldom do I ever, I have been taking the Teza, whatever they are.
Tizanidine.
Yes, because at nighttime, it helps with the pain,
And you have that.
and I go to sleep. Yes, I do have that. And I have Flexerils too from months ago. I still have almost a whole bottle.
Okay.
Because I don't like taking them, They give you all these medicines, and, God, Lord. Now, I do take my gabapentin, because I have neuropathy, okay?
You were first given the Embetta in January. How come you didn't say anything then about side effects? You were given it again in February.
Yes, that's
Why
when,
are we hearing about this the first time
that's
today?
when I started, because first I seen Malik, then I seen Joseph.
Malik gave it to you January 8th.
And then Dr. Joseph did.
Yes, he refilled it for you, but there's
Yeah.
nothing. You didn't tell him anything about.
Yeah, no, I told him sometimes you have to get used to the medicine.
And how come it's not in your system? What's happening?
Because
to
I
it?
haven't taken it. I haven't been to pain management. I've been going to the emergency room.
So if I
Or
tell the
my
DEA
pain.
that it's not in your system because you say you haven't been taking it, but you accepted the refills,
No, I was
What?
taking the Embetta.
it's not in your system, is what I'm saying.
No. Oh my gosh, I don't know
She
why.
quit taking it at the beginning of February when she went in the hospital because she thought she was going crazy.
And
because
yet
she
she
was seeing
accepted a
things.
refill for it on February 15th.
Okay.
That's the
I'm
problem.
trying to explain. Okay.
I think maybe we should just stay away from pain medication for now because I don't know what's going on with it, and 2 drug screens
Will
have
you
said negative
please?
for it.
But I was taking the Embetta. Okay, it was till I started feeling funny. Okay. And then I stopped taking it. I went to the hospital and they admitted me because they did x-rays of my chest and I have 2 black spots and they thought I had pneumonia. Now that was when, around that time, I stopped taking it to see if there was the side effects because I was seeing double vision. My eyes were sensitive to the light and stuff like that.
It doesn't sound like side effects from that medication, by the way.
This is what I'm saying. I don't
what I'm
know.
going to do is, you stopped taking it. You're not on it right now.
No, but
so
right now I'm
gonna-
having to take all my muscle relaxers, 20 Tylenols at one time.
Don't threaten us with how much you're overtaking other things because doctors are not responsible for you doing things like that at home and hurting yourself.
But that's why I'm here.
If you're taking 20 Tylenols at one
no.
time and you know you shouldn't,
I'm not
That's
taking
on
20,
you.
but
scaring us into
But
giving
I'm
you
not-
narcotics
I'm
is not
not.
really a great idea.
Okay.
I'm hearing a
I'm
lot
sorry.
of
I'm just
kind of listen. If you can go without it, then let's go without it.
I'm in pain all the time.
Well, then why don't we figure that out? Let me get the CAT scan.
Okay,
Let's get the EMG for the carpal tunnel, which is these are very solvable issues.
So in the meantime, I'm
You know?
just supposed to keep on suffering?
You aren't even taking it. If I screen you now, you'll come up negative
I was
again. You said I stopped taking it.
Oh my God.
Told me that at least 10 minutes ago.
When the hospital, they were giving me morphine. But,
They give it to people IV there. It doesn't last a long time. I'm sorry, and
It's
then there's the
okay.
concern of seeing things and everything. It's better not to do it. That's my clinical judgment on that. It's better not to.
so I just walk around in pain. I'm tired.
You know, a lot of
being in-
people don't take narcotics. It's not an incredibly difficult thing
No,
to do.
it's not. No, you're so correct. You are right. Yeah.
No one in my entire family has ever taken one.
Well,
It's
that's
not
good.
impossible. It's
That-
not
that-
impossible.
Everybody's different. Okay.
It's-
well, then they
it's-
shouldn't have never made them to begin with.
Well, they're not
Yeah.
made. They're not made for here and there pain.
I'm
Let's
not-
figure out what's
You
going
don't
on.
understand what I'm
You
saying.
wanted workup. We'll do the workup. We'll figure out what's
Okay,
going on.
Okay.
All right. So she'll schedule you for the test for your arms and hands. It'll tell you if you got a pinched nerve.
How
from
about
your
my
neck.
neck, my
It'll
back?
tell you if you have a pinched nerve from your
my
neck
whole
also.
back. Okay. Yes.
No.
No.
It's a test for your arms and hands.
Okay.
That'll tell you if you have a pinched nerve from a bulging disc in your neck or if it's just irritated.
Okay.
And it'll tell you if you have cubital tunnel, carpal tunnel, or neuropathy.
Okay.
All of those things with one test. It's called the
Not
EMG
neuropathy.
neuroconduction study.
Okay.
Give yourself about an hour for it. Okay?
Okay.
It's a test.
Okay.
And we'll schedule that for you so that we can figure it out. I'll have you sign a
Okay.
medical release so that we can get the CAT scan from
Yes.
I don't know where that hospital
Rustall.
is. Okay, so that we can see
It's
what's
in
going on.
Rockledge, Florida, down by Cocoa.
And if you're allergic to steroid and you can't have a steroid injection, we will send you to see a surgeon if it's bad enough. Okay? Because the epidurals contain steroid. They
I know
can't
they-
contain just lidocaine. but
Okay,
you
now
have
what,
to.
what about my lower back, my middle back, and my upper back? Because I have levoscoliosis, I have sponiosis.
You know how funny that sounds to me?
No,
Sounds like you're
this-
reciting an imaging study report.
Yes.
How bad is the scoliosis?
Yes.
Clearly not braceable,
No,
clearly
not
not
yet.
surgical,
No,
not
no.
Harrington rod
What
placement.
I'm saying is just
Everybody has a little bit of it. Everybody. And so if the report says minimal levoscoliosis, to a spine physician, that's not the most dramatic finding.
No, it's not.
No, it's
But
not.
you
But
know,
you're reciting
I
it off
can't
of your
even
reports.
walk. Yes, because I don't know much about this. I can't even walk a block
Don't
without
think
my
that's-
back. You know, my hips, my whole
I-
body. I'm so sorry, but
I'm
that's
sorry,
the
but-
truth.
You know, we need to find out what's going on. You know, they tried to do a shot on you and you said you were sore from it. We can't gain any information from that. If somebody says, "Well, I was sore from the shot," I
It
can't
just
garner
seemed
any
to make my
information
back
from
hurt
that.
worse on the lower
See,
part.
and that's the one response over the last 10 years. When I hear that, I say,
Uh-huh.
well, this person, I'm not sure we can help them. They want to do a pill. They'd rather not do a shot. We may not be the place for
continue
that.
doing the shots because the one doctor told me sometimes it takes 4 series. It can take up to 4 series.
That's the first thing that I told you. You have the
For-
option to repeat it
Yeah, I mean, if you think, you know,
to see if it'll
this
help you.
is
But
why
you have to
yeah.
think now this time. But
Yeah.
to know that you have a few hours of a window, maybe a day afterwards, because you don't want steroid in it. right?
Mhm, Right.
So you only have until the lidocaine wears off to know if it gave you relief. That's the important part for you to keep track of. Not, they poked me a lot, it made me sore.
No,
I can't get any
I
information
know
from
the
that.
difference. I know the difference.
You know?
The
Can you bend better? Can you walk a little longer
doctor,
when you
what's
stand
his
up afterwards?
face? A very good doctor. God bless him. He says sometimes, it takes a series of
Those are epidurals. That's not what you're doing. These are facets. That's okay. I don't expect you to know the difference. These are for the joints in your back.
Yes.
Right along
Yes.
here, not for bad discs. You're not complaining of sciatica. You're complaining of back pain.
Yes.
So we have to treat the back, the joints in the back. Okay?
Yes.
So that's why it's not done as a series. It's an algorithm. There's more than one step to it, yes. But the first step was kind of a wash on you because you just said I couldn't tell. I was sore from the shot.
Well, I was supposed to go back also. I was going up and I was in the hospital.
Yes, there are these long periods between your visits, and it's harder to track a patient when you lose them for 6 weeks at a time. We'd rather see you a week or two afterwards to know, how did you do, type of thing. It's much harder to track if we don't know.
You got my purse?
Yeah.
Is your phone in there?
My phone's in my pocket.
I'll have Dr. Sawaris do that
Recording?
here at this office so that you don't have to drive further up. The EMG is going to be in the closest possible location. We have 8 offices. I'm not sure which one will be able to get you in for that EMG. Orange City, we do it. We do it in Palm Coast. And I think right now that's it.
Palm Coast should be closest. What's the EMG?
That's the nerve test for your.
Oh.
For your hands and neck.
Yes.
Yeah. So they'll schedule you both things today. Let's see how let's see how we do. Let me get a medical release for you to sign so that we can figure out what happened with your CAT scan less than a month ago. It's important for us to have spine studies. That's a good thing for us to have.
Yeah,
Give me 1 second. She'll get you a medical release and just give her the name of write down the name of the hospital so we can give it.
Fucking bitch, man.
What did you